If you've ever needed a specialist when it comes to medicine, there are plenty of options, from ophthalmologists to ophthalmologists to orthopedic surgeons. But we found a doctor here in the Valley that specializes in a niche group. Here with us today is Dr. Rob Hilvers. We're so excited to have you on the set.
Yes.
Yeah, thank you. So I want to start off and just ask you this question. Did you know you always wanted to be a doctor?
No, I decided later in college, I thought I was going to work for NASA, I thought about going into medicine. I got injured in college playing ball, and I had surgery and ended up becoming friends with my orthopedic surgeon when I was in college in New York, who convinced me to try to think about medicine over the years. And finally, my junior summer, working with him, I decided to sit really late for the medical school entry exam and did well. And so it was a late decision. It was a good decision.
So from that time, you're at that moment to this moment, you now have this niche community that you're really serving, and these are first responders. So tell us a little bit. I'm just curious, how did that even come about? Because no one else is really doing this.
Yeah, so I started off, I really wanted to go into family medicine. I wanted the ability to do international medicine and be able to treat really as much as I could treat. Along the way, I was very fortunate to get a job working in the emergency room in St. Luke's, which has been wonderful. About 2004, I also got a call from Boise Fire asking if I would be willing to take care of the Special Operations Dive Team. And so it was 30 members. We did it in September. It was great. We put together a quick makeshift clinic. The next year they said, hey, would you also be willing to see our hazardous materials team? So it went from 30 to 60. And then the following year they also said, hey, what about our high angle rescue team and our guys over 50? And that next year, Meridian Fire had called and said, hey, would you be willing to see our recruits?
And it's different for first responders because you're dealing with physical therapy issues. These guys get injured differently on the job than your average desk jock, right? But there's also a cardiac side of it too, that they're a little more at risk. Is that
If
correct?
I were to say there were probably three things that we take care of. Number one is cardiovascular risks. Number two would be orthopedic musculoskeletal injuries, and probably behavioral health. But when you look at just cardiac disease among firefighters and police officers, so studies have shown that firefighters have about a 4-fold increased risk of online cardiac death. Police officers almost 2-fold increased risk.
Wow.
And so when you think of an average 45-year-old, you think 3 a.m. alarm goes off, right? So you get this sympathetic heart rate, blood pressure's through the roof. You haven't even got out of bed yet, right? Your heart rate's already up. So then you put these turnouts on, your core temperatures start to rise, and then you throw severe physical exertion into the mix. And then I always say you throw pride into there, right? These guys are very passionate about what they do. They're there to protect. And so average firefighter is not going to stop when they have some chest pain, and so they will often work through that.
They're the warriors.
They're the warriors. And I would say the same thing with law enforcement. I was involved with 2008 when we had that bench fire, and I was in the emergency room that night, and we had 7 Boise police officers show up in the emergency room with inhalational exposures. They were truly the first responders at that fire, so they also have those risks.
And you've been written up in some magazines regarding this care because no one else is really doing this. So tell me a little bit about that as well.
Well, Chief Michael Masterson, who was the police chief, recently retired, wrote an article about a cardiac study that we have ongoing with St. Alphonsus right now. And it got picked up nationally, and so we were getting calls from a lot of East Coast departments about, so what is the program? What is this wellness program that you have? And so I got a call from the chief editor in Massachusetts about writing an article about our program. So we got published August of 2014.
Also, I want to know, you worked in the ER for a little bit of time. Is there a life lesson that you learned working in the ER?
Yeah, so as a patient, so
as a patient,
4 years ago, I came off of night shifts doing ER work, and I had a terrible road bike accident. I hit pavement at 30 miles an hour, my fault. And I had broke my severe femur fracture. I had broke my femur in really 6 different places, and spent the entire night in the OR. I woke up with a plate and 13 screws in my femur. I dropped 60% of my blood overnight.
Yeah, so and did that change how you practice medicine now?
It does.
Yeah.
It makes you very humbled.
Yeah.
And I think you have a much better perspective on people with the concerns of disability, the concerns of pain, the concerns of losing your job.
If people want to get a hold of you, any capacity, how can they do that?
So easiest way is through the website, so www.er-hc.org.
Okay, well again, thank you so much. You have the website on the screen.